Wow, you guys got silent all of a sudden. I just said take your seats. So we're going to start the next panel. This panel is going to focus on healthcare and the opioids crisis. Mercedes Schlapp, a senior communications advisor, is going to moderate it. And it's going to feature Kellyanne Conway, counselor to the president, and Seema Verma, CMS director. And with that, I'll introduce them to the stage.
It's already afternoon. I can't even believe it. The hours here go by very quickly at the White House. So good afternoon, everyone. Thank you so much for being here. Not only as a woman, but as a mother of 5. We know that for me, healthcare is one of the top issues that we deal with, and also a top issue for American families. What we have seen is Obamacare basically collapsing. And we have an opportunity here to talk about how healthcare in America, it's going to be better under President Trump. And we have the perfect person to be talking about that today. With that, I want to introduce both the panelists here. Another issue that we're going to be discussing as well is on the issue of opioids. It's an issue that's been impacting families across the country, communities also being impacted with so many Americans dying every year because of overdose. And it's incredibly a sad story here in America. And we're going to be talking about how President Trump and his team is committed to combating the opioids crisis. And I'm very much honored to introduce the two panelists here. I've gotten to know them both so well, and they're just incredibly talented in being able to talk about these issues of healthcare and obviously the opioids crisis. Kellyanne Conway, she really does need no introduction, is currently serving as counselor to the president. She was the first woman campaign manager to win a presidential campaign. We're all very proud of the work that Kellyanne's doing day in and day out for President Trump. And next to her is Administrator Seema Verma. Seema, for over 2 decades, has guided healthcare policy in the public and private sector, helping create and implement the nation's first consumer-directed Medicaid program. On March 14th of 2017, she was sworn in as the 15th administrator of the Centers for Medicare and Medicaid Services, with a commitment to empower patients to take ownership of their healthcare. Thank you, Seema, for joining us. So to start off, I'll let Kellyanne come over to talk about the opioids crisis and what the president and his team is working on to combat this issue that is, as we know, devastating to so many families here in the United States.
Thank you very much, Mercedes. It's a true pleasure to work with you here, too. I very much appreciate that kind introduction. I want to get right to the topic. The topic can be very harrowing and very sad, but we also feel that since it is a nonpartisan issue in search of bipartisan solutions, we feel very emboldened that under this president's leadership, we will be able to tackle the 3 major challenges when it comes to the opioid crisis, which we call the crisis next door. And those include prevention and education, law enforcement and interdiction, and treatment and recovery. And those are not meant to be done sequentially at some time to be designated in the future. They're meant to be tackled all at the same time. Right now, as I stand here, roughly 116 Americans are dying every day from an opioid-related death. Think about that, 116 a day. From 2015, where 52,000 people died from drug overdose, to 2016, the numbers went up to 64,000. And sadly, those numbers may get worse before they get better. We didn't get here overnight, and we won't be able to change this overnight either. But at the same time, with the president's commitment in that October 26th address by the president and the first lady, when they both tackled the policy part of the opioid and drug demand crisis in our nation, since then the president has directed his entire administration to take action. And indeed, it was a call to action for the whole country. So what is being done and how can we help? As we travel around the country, we meet different types of people who are affected in various ways. Some, of course, have lost loved ones to opioids. Others are successful give us their successful stories of treatment and recovery. And those are very heartening, and we've met with them firsthand, and then they take their successes and they try to help others who are in need. We also meet with law enforcement. We meet with DEA agents. We've met with healthcare professionals, faith-based leaders, folks all across the spectrum of responsible individuals. The reason we call this the crisis next door is because when you look at the statistics alone, you recognize that opioids is affecting everyone across geographic, demographic, socioeconomic lines. Truly, no state has been spared and no demographic group untouched. What is really searing about the opioid crisis is the rapidness with which the use and the overdose and the deaths has occurred. The CDC last month released its statistics showing that there's a spike up in these deaths, but many of them are being induced by something called fentanyl. That's a synthetic opioid, and that is responsible when it is laced into a pill somebody is taking, or whether they're taking the drugs through a different means. Fentanyl-laced deaths they're really what's spiking up. And I think that we suffer from information underload in this country when it comes to fentanyl and synthetic opioids such as that, and even illicit use of legal drugs. Fentanyl, of course, is 50 times more lethal than heroin, 100 times more lethal than morphine. And it is, with the information underload, means that just this past November, this administration put out a one-pager on safe handling or proper handling of fentanyl for our law enforcement officers and for others who may come in contact with it. But in addition to that, what we see is as particularly challenging about the opioid crisis, and we, of course, have had drug demand in this country for many years, but with opioids, it's very tricky because often it starts in the family medicine cabinet, and on that label of that tiny bottle bears the family doctor and the local pharmacy. And so that was meant to help someone somehow in some way. And that either becomes very tricky for folks who are otherwise persuaded it can't hurt me because it was meant to help mom, dad, or grandmom, or my friend's mom, or they're using that as a cover, as a mask for non-adherent use of somebody else's prescription. But the good news is, whether it's through increased funding, increased awareness and coordination, here at the White House we have what's called an opioids cabinet, where we literally meet on an ongoing basis just to coordinate the dozens of programs that already exist across a dozen or so agencies and departments. And that's everything from the interdiction piece like DOJ and DHS to the treatment and recovery, HHS, VA, for example, and then certainly prevention education, Department of Education. We also see a role for Department of Labor, for housing and urban development, because we recognize that first we need to destigmatize so people feel free to come forward and say that they do need help. Taking away that decreasing stigma and increasing awareness and education are incredibly important to the success of this effort overall. In addition to that, we recognize that some people who are lucky enough to get treatment, go through recovery, are then looking for housing opportunities, skills, training, jobs, and such. And so we're trying to tackle the individuals who are affected, and indeed the entire crisis next door, all at once as such. How does it affect women particularly? Well, women tend to disproportionately be the healthcare consumers and the healthcare providers. And if you look at opioid use overall, women are more likely to take a prescription opioid than men overall. You see a doubling in the number of Americans who sought out emergency room treatment for opioids, and that includes women. But also, since women are disproportionately the healthcare providers, and the healthcare consumers, they're seeing it from both ends. And it is affecting them, but that also gives them a heightened sense of responsibility and, in fact, skill and opportunity to help bend the curve in the right direction. And so we're very, very hopeful about that. Just last week, the president signed into law the Interdict Act, and I thought it was a great example in the Oval Office of a bicameral, bipartisan way to show America that there can be agreement on this issue, not to put petty partisan politics in the way of progress. And so we had Democratic and Republican House members and senators standing with the president as he signed into law the Interdict Act that had to do mainly with fentanyl handling. Recently, the Department of Justice announced its first new DEA office opening in Louisville, Kentucky. We haven't had one in 20 years in this country, so it will be there. And also to designate in each U.S. Attorney's Office a special opioid opioid designated individual who will help with this. Also, we're trying to work with those who are charged with curriculum and educating our youth that they're worth more than a pill, that they can be somebody, not a statistic. And in that regard, our First Lady has taken on this issue in a very bold way. You heard her remarks on October 26th, and prior to that, I had the privilege of traveling with her to West Virginia when she was on the ground at a center called Lily's Place, which helps with neonatal abstinence syndrome. These are our newborns increasingly being born dependent on opioids and other drugs. That has quadrupled pretty much in the last several years, the number of newborns being born dependent. And so there are many different ways that we're going about this. I also just wanted to point out that recently the Health and Human Services gave clarification on the HIPAA laws, and I think this is already going a long way to saving lives and mitigating unfortunate circumstances. Essentially, we have encountered so many families across this country who tell their story of their son, their daughter had been resuscitated 5 or 6 times, but that last time he or she were too far gone. But the parents literally say, I didn't even know he had a problem. I didn't know she was using. And I know some of those bold stories are here right with us today. And thank you for your courage and for sharing and for being on the front lines and helping other people to avoid the same circumstances as we come together. Yes, thank you very much. But basically what HHS has said is that there are circumstances, crisis circumstances, that give healthcare providers broad ability to share information with family members in those crisis situations that would not violate HIPAA. The IMD waivers that Administrator Verma's office are reviewing and issuing have been incredibly helpful. Most recently, I believe Utah and New Jersey, adding them to the list. I think we're up to 8 now, 8 states that have an IMD waiver, and the administrator can explain more about that. But essentially, we don't want the number of people who could be treated in a facility where beds are available to be enumerated by the number of beds, meaning you can't get Medicaid reimbursement if you have more than 17 beds. So we're really trying to get it in that way. Also, NIH is doing some groundbreaking work, as are some of the private companies, with respect to developing non-addictive opioids. We recognize that pain management need not mean pain medicine for all Americans, but for many Americans, they do rely on pain medicine. And that's not what we're talking about here. Essentially, we're talking about the sports injury, the surgery, the dental procedure, where the individual is offered a 30-day supply of prescription opioids and doesn't necessarily need them, and it becomes a gateway to other behaviors, and certainly for some full-on addiction. We also recognize, as the President made clear on October 26th, many people are already in treatment, and that needs to continue as well. But we need that education and prevention piece as well, so that we're telling our youth, but really everyone. And lastly, I would like to say that we've been incredibly heartened by the response literally from all over the country for people who didn't vote for the president, don't bother to vote at all, don't care much about the political process. They see this as an issue where we can really bend the curve on behalf of our brothers and sisters across this country. We've talked to the major sports leagues, we've talked to the tech companies, we've talked to philanthropic groups, we've talked to corporate America, we've talked to small business America. Nobody has said no. Everybody has come forward and has wanted to help. And so part of what we're doing now is just trying to organize all of that, find out what the best practices are to carry forward, where are we duplicating and not replicating, and really to continue to hear from the brave men and women on the front lines, more often brave women on the front lines who are willing to help as well. So as we do that, we would like to call upon you too to help. There's really a place for everyone. And finally, I'd like to say that we are developing a dedicated website here at the White House where people will be able to share their stories. And we think that the president went first. He shared his story about his brother Fred, who passed away at the age of 42. And he shared that story spontaneously in his own words on October 26th. We'd like the rest of the country to feel comfortable to share their story too, whether it's triumph in treatment and recovery, sadness and loss and grief, whether it's a healthcare professional, law enforcement officer, anyone at all. This is the crisis next door, and I think that when people look at folks in their neighborhoods and they say that I like you and you are like me, it gives them the courage, really, and the courage and encouragement to come forward and be part of the solution. Thank you very much. Administrator Verma?
Thank you, and thank you, Kellyanne. You've been an inspiration to many women, and we appreciate all of your hard work. Well, I am so proud to be here today and honored to serve the American people and an administration that is truly committed to women's health, families, and children. That leadership is advancing the best ways to help those in need by making a lasting difference in their lives every day. So a little bit about the Centers for Medicare and Medicaid Services, commonly known as CMS. At CMS, we have a number of programs, and we serve over 140 million Americans through the Medicaid program, Medicare program, and products that we have available through the exchanges. In our Medicaid program, we are serving pregnant women and children, disabled and the elderly, some of our most vulnerable populations. And with the Medicare program, we're also serving the disabled and our senior population. But it's not about the 140 million people as a whole, but I like to think about it in terms of the individual. From my perspective, I just had a recent scare, a family health scare with my husband having a heart attack. And it really gave me some perspective about what patients go through and the things that they face when they're having to deal with the healthcare delivery system. It's not easy to navigate the healthcare system. What doctors do you pick? What treatment options work best? And how much is it all going to cost? These are issues that all Americans face, and at CMS, what we want to do is empower patients. We want to make sure that patients and families and women who are often making the healthcare decisions for themselves, their partners, their children, and their parents, that they have the information and the tools that they need to make the decisions that work best for them. We want to get Washington out of the way and return the decision-making about healthcare to individuals, people, and have that interaction occur between patients and their doctors. So, a couple of things. One of the other things that we're doing at CMS is making sure that our programs are modernized to deal with the changing evolution of technology and innovation in the healthcare industry. And as Kellyanne said, we're also trying to do everything that we can to respond to the opioid epidemic. For all of this, for all of us, this can be very personal. And for me, I remember just a few years ago when my daughter was only 13 years old, and we attended a funeral it was a kid in her class, and it was her older brother. And like so many kids, he had gone in for just a routine surgery and become addicted to pain medications. And I remember the funeral and the words of Audrey, his sister, who was only 13 at the time. And she talked about the anger that she felt at her brother for getting mixed up in all of this, and the tragedy and the heartbreak in her voice as she talked about never being able to see her brother again. So this is a personal issue for all of us, and we're trying to do everything that we can at CMS to address this issue. We're very appreciative of the President's leadership. Because of his leadership, HHS declared the opioid issue a public health emergency, and it's allowed our agency to take immediate action. As Kellyanne referenced, one of the things that we're doing is making it easier for states to provide treatment to individuals facing opioid addiction. One of the things that we found is that when people are ready for treatment, we want to make sure that that treatment is available. They don't want to hear that there's a waiting list or that that there's not a bed available for treatment. And so we've gotten rid of, or we're allowing states to waive certain laws that prevented individuals from getting treatment. And it was really heartwarming for me to go to Utah, state of Utah, where we had approved one of these first waivers to allow for individuals on Medicaid to seek treatment in certain types of facilities. And they were actually, they had construction going on because they were expanding the treatment center because they now know that they can serve individuals. They don't have to worry about a 16-bed limit. And I also was able to travel to New Jersey, where I got to meet a woman named Vanessa. And she had been facing addiction. She wasn't able to get treatment because of the IMD exclusion and not being able to receive services at a certain facility. And she ended up in jail. And ultimately, she got out of jail, she got clean, she was able to get treatment, and now she's spending her time helping other individuals get the services they need and providing a resource and support. So victory is on the horizon. We know that we can address this issue, and there's stories like people like Vanessa that we hear about that are inspiring to all of us. So again, appreciate the opportunity to be here and look forward to your questions. Thank you.
Well, these are the untold stories. This is the type of progress and work and commitment by this administration and by President Trump. Now we'll turn to the women on the stage. Want to introduce just a couple of women on the stage. Pam Bondi is with us, who's the current Attorney General of Florida. Thank you, Pam. Rebecca Clayfish is the current Lieutenant Governor of Wisconsin. And Catherine Burgum is the First Lady of North Dakota, who has been working on these initiatives for fighting addiction in the North Dakota communities. Before we turn to the questions from the stage, I would like to take a moment to introduce a special guest who has been working hard every day to lead the charge to empower women and all Americans. Ladies and gentlemen, the President of the United States, Donald J. Trump.
Hello, everybody. Sit down, please, please. I wasn't very far away, so I said I'd love to do this. This is fun. But I want to thank you all and really for the job you've done. I know Ivanka just left. We really appreciate it. It's been incredible. You know what we've done in our tax bill, and you know how successful it's been. And we had women front and center. I think you all know that. But I'm honored to stand here with the women across the administration, from all across the administration. They have been incredible. I just look, and our Kellyanne has been something. Everybody up here. There's Pam Bondi doing such a great job in Florida. We're proud of you, Pam. Everybody up here has been a friend and very, very special. I want to thank First Lady of North Dakota, Catherine Burgum, for being with us today. Catherine, thank you very much. Thank you. Lieutenant Governor of Wisconsin, Rebecca, thank you. Great job, Rebecca. Good. Huh? We're doing okay in Wisconsin, that's for sure. It's a great place. And I also, Pam Bondi, again, we want to thank you, Pam. Thank you very much. To Arkansas, great state. How did I win Arkansas by so much when she came from Arkansas? I don't know. Something going, but Leslie Rutledge, thank you very much. Thank you. Thank you very much. Thank you, Leslie. Thank you, Leslie. Appreciate it. Chairwoman of the Republican National Committee and in charge of our campaign in Michigan. And when we won Michigan, I said, I got to keep her going because Michigan hadn't been won in decades. And so Ronna McDaniel, where's Ronna? Ronna's here someplace. Thank you, Ronna. Great job. Great job. Thank you. And you're representing everybody very well on television. I love your appearances. But women represent half of the population, but they care about 100% of the issues that face the nation. That's for sure. We're making incredible progress. The women's unemployment rate hit the lowest level that it's been in 17 years. Well, that's something. And women in the workforce reached a record high. More women in the workforce today than ever before. That's really terrific, and especially since it's on my watch. I feel very proud of that. I have to tell you a statistic that just came out recently, as you saw, that the black unemployment rate, the African-American unemployment rate, is the lowest it's ever been in the history of the report. So we're very honored by that. It's really a great thing. We've enacted massive tax cuts. You've seen it. You've seen what's happening. I have to tell you that far beyond our expectations. We thought on February people would start to see their paycheck have a little more money in it. And you pick up that extra $200 or $300 all of a sudden on a monthly basis, and sometimes on a weekly basis. That has a big impact. So we thought it would be February, and little did we know when the company started. AT&T started it, but these companies started giving out $1,000 to everybody. All of a sudden, it was one after another. Now the few that haven't, they're all saying, the employees are saying, "What about us?" So that's going to happen. So it kicked in a lot faster than we thought. But the stock market is way up again today, and we're setting a record literally all the time. And I'm telling you, we have a long way to go. And had the other side gotten in, the market would have gone down 50% from where it was. 50% from where it was. Remember that. It was stagnant and it was going down. And all you have to do is look at the GNP from the beginning. Just take a look at that GNP. And you look at it, if it's, any way you want to look at any statistic. You could look at GDP, you could look at any statistic and take a look at where they were. But GDP in particular, it was stuck and heading down. And we took off restrictions, we took off regulations, and we still have plenty of regulations, although we're cutting a lot of them too. But you don't need You don't need 9 different regulations. We're looking now at Dodd-Frank because we have to free up so the banks can loan money to great people, because the banks haven't been able to do that. They were restricted. A person came up to me at a recent stop and said, all my life I did business with a certain bank, and now all of a sudden they can't do business with me. I've always paid my debts. I've always paid my loans. The bank loves me, but they're prohibited from doing. Now they're going to be able to do business with that person again. So we're doing a real job on it. But the regulations had a lot to do with the success. Don't let anyone kid you. Without taking off those regulations, I mean, look at what we've done just in terms of pipelines, 48,000 jobs from almost day one. 48,000 jobs on really things that were never going to get built. They weren't good. We have plants all over the country that are getting built. Toyota's now moving back. Mexico, it's very interesting. Chrysler is leaving Mexico and moving back to Michigan. You haven't heard that one. You haven't heard that one in a while. And one of the important things we're doing, as you know, doubling the child tax credit. And that's something so important to all of us. So women-owned small businesses in America will now be able to deduct 20% of their business income, which is something that people didn't expect that they would be seeing. My presidential budget was the first in history to include a nationwide program for paid family leave. And we're partnering with communities to end the scourge of drug addiction that has plagued our country. I mean, you talk about a problem. That's a problem that we are working very hard on. Pam has worked very hard. Everybody here, even if they're not totally involved with that, they're all working hard on it. And some people within the family themselves, unfortunately, they're really working because they have people within the family that are in trouble. So that's number one on our list. If you look at what's gone on, there's never been a time like this. And it's a worldwide problem. Some areas take care of it through very, very tough measures. We don't. We're not prepared to do that, I guess they say, as a country. But we have a tremendous, massive drug problem and drug population, and we have dealers all over the country, and we are hitting them hard, the dealers. The dealers are being hit hard, but what they've done to families and what they're doing to the country, and it's something that we are very focused on. Whether it's the opioids, whether it's drugs, as you hear in the traditional sense, much comes through the southern border. You know that. People don't like to talk about it. They say, oh, why do you mention that? Because it happens to be true. But they come in through many different places and means, and they come in many different ways. But we are on the drug problem as much as you can possibly be on it. And we're going to get it taken care of one way or the other. And frankly, the tougher we get, the better it's going to be, the faster it's going to go away. We have got to get really tough on that problem because it's eating away at the heart of our country. So with that being said, I just really appreciate you all being here. It's an honor. Again, when I heard, I ran across the street. Now I'll run back. Now I'm going to run back to the Oval Office. But we really have. We've made a tremendous amount of progress, and it's now 11 and a half months, and we've made a tremendous amount of progress in a very, very short period of time. When you look at what's gone on with the employment, when you look at what's gone on with the stock market, we've created now almost $8 trillion worth of value just in the stock market. That's not mentioning all of the other things that there are. So we have a country that's on the right track. We're working on immigration and immigration reform, and hopefully at some point we'll be able to solve that problem. If the Democrats really wanted to, they could, but they really sometimes don't want to. But we're working on it, and we'll get it done one way or the other, I hope. So thank you all for being here. It's an honor, and I will see you all soon. So many friends. Thank you. Thank you very much. Thank you very much. Thanks, Ron.
Okay, you all can go home now. No, I'm kidding. I'm kidding. Kelly Sadler will kill me if I say that. So we'll move over to, well, that was quite a treat, wasn't it?
Yeah.
It really is such an honor to work for the president and be part of this team and his commitment every day for American families. And with that, want to turn to our women on stage who will be asking questions to Kellyanne and Seema on this issue of opioids and health care. What I'd love to do is if you all can introduce yourselves and tell us where you're from, and then go ahead and let's start with the questions. We'll go.
Thank you. I'm Debbie Taylor. I am with Phoenix House. We are a drug treatment provider nationally. Unfortunately, I've been in this field for over 40 years. I was telling my colleagues that this is the 6th administration that I have worked with in an attempt to solve this problem. In this political world that we're in, this is not a political issue. This is, as Kellyanne was saying, I mean, an absolutely nonpartisan issue. My question is due to the intensity and the toxicity of the chemicals that are now on the street that you alluded to, what can we do realistically about providing instant access? Because as much as we would like to think it exists, it doesn't. I have people who die waiting to get in, waiting to get a bed, to get a bed, and then on the back side of it, when they leave, the resources are not there to maintain the medication they need. So that all the good work that was put in a workable science-based treatment program goes for nil because there's nothing there to support. Thank you.
Well, that's a great question, and I think that this is about building systems of care. We have to look at this as comprehensive treatment. So looking at this from many different angles. It's when people are ready for treatment, making sure that they've had access. I think that's why the president's leadership around declaring or having a public health emergency, it's really allowed us to make sure that we can expand services. Kellyanne mentioned the states that we've approved waivers in. Just last week it was Kentucky, and we've got a few other states also in the pipeline. So I think that that's going to be a major piece of that. And what we've asked states for do is they're putting these proposals together. It's not just about, expanding treatment, but we're also saying we need to develop a continuum of services, comprehensive services, so that we know there's detox, but that's only one piece of the puzzle, right? It's when people are leaving the facility that they make sure that they have outpatient services. And this is a critical issue. When I look at the problem from the Medicaid and the Medicare perspective, we're dealing with not only the addiction, but there's also other comorbidities. We know that we've had an increase in hepatitis and HIV. I look at this in terms of, from the Medicaid perspective, the Medicaid program delivers 50% of the nation's babies. And we know that there's a lot of babies being born with withdrawal symptoms. And what does that mean for the healthcare delivery system over the long term? What are those children going to need as they grow up? We're also looking at the foster care system because more and more kids are going into foster care, and those systems are overwhelmed. And we have to think about what are the health care needs for for these children. But again, it's about building that comprehensive system. And so as we're working with states around expanding services, we're also working with them to figure out how can we develop that comprehensive system. Because as Kellyanne mentioned, it's prevention, but it's also treatment and enforcement over the long term. We've also heard a lot about the medication-assisted therapy and how important that is. And so we're trying to encourage states to avail those services. We actually had a joint meeting last week with the leadership of CMS and NIH, and they're doing all kinds of exciting research around medications. And they're also stressing some of the new evidence around medication-assisted therapy and how important that is. So we're working with them to make sure that people are aware of that.
I just wanted to very quickly that even though this has presidential pulpit behind it and administration-wide attention and effort, we don't believe that the best ideas and solutions come from Washington. We still believe that the people closest to the people in need know best how to service them and their needs. And I'm really struck meeting firehouse chiefs who double function now as healthcare professionals. If you have a Good Samaritan law, which I believe 41 states or so do, and you're driving your overdosing friend, you will not be prosecuted. You get there, and they do a warm handoff to the healthcare professionals. So it is about accessing naloxone and other overdose reversing drugs. We recognize fentanyl is almost naloxone resistant. Sometimes you need multiple doses. Some of these places are running out of their doses early in the month. And so we've heard all types of things, but this is what's important. It's listening, learning, and coordinating that from here, but not displacing or overriding, really, preempting what the states are doing. Different areas have different needs, and we're very respectful of that. But I hear you clearly. I honestly believe that this president is going to, and his efforts will bend the curve in the other direction. I'm really happy what we've heard from people in the private sector and the public sector about great ideas they have, and they just need an administration that wants to put them all into practice and give it a try. We also talk to the faith-based community all the time, too, the local employers. Administrator McMahon can be very helpful in that regard, too, and is, because they see it. They see it in their employees. They see it in employees who can't pass drug tests, the would-be workforce. And they see it in their communities as well. So we will continue to believe that these solutions will come from the ground up, and we're here to help direct and implement and fund them.
Next question.
Hi, my name is Emily Raitt. I am currently about to hit 6 years sober next month. Thank you. I have tried many different methods. It was a faith-based program, actually, that helped save my life. That was a year-long program. I am currently 6 months pregnant. I am also now a wife, a homeowner, and employed. So. I had the privilege of also working at the program after I completed for 3.5 years, and I now work for Unshattered, which is a purse line company that employs women that were previously addicted, so to help on the other side of exit plan. My question to you is, with the current statistic of what the CDC put out that said that 3 out of 4 new heroin users started off with prescription opioids, what is the current plan to significantly reduce that? And then has it been looked at about reducing the chemical compounds that are actually put into it and regulated by the FDA? Has it been looked at maybe significantly reducing the amount that is being able to be put out, somewhere similar to the 1980s when Gene Haleslip actually put that out for the methamphetamine problem?
I'll just say very quickly that the major chain drug stores, along with pharma and some others, have come out and said that they favor a first prescription of 7 days, not 30, so that you do go home with a smaller amount. Some states like Massachusetts and New Jersey are really great examples where you had Republican governors working with Democratic legislators to come together and reduce the first-time prescription to 3 or 5 or 7 days, depending on the state. So it is possible, and it is happening. I will let the administrator talk to the chemical compounds and what the FDA, or colleagues of the FDA, are doing as well. But Dr. Gottlieb is another superstar, frankly, on the front lines of this, as is, I mentioned, NIH and Dr. Collins and Dr. Jerome Adams, our Surgeon General, Administrator Vermer. You're talking about a full-on You're talking about a full-on offense, really, on this issue. But I think that's very positive because let's face it, with supply and with oversupply comes more demand. And I wanted to go back to something I said 40 minutes ago, which is because it's in mom and dad's medicine cabinet in your house, that the liquor's locked up, and nobody's in a back alley with a needle coming out of their vein. It's in mom and dad's medicine cabinet, and that tiny bottle has a label that bears the family doctor and local pharmacy. That is what makes this so different and so, I think, unsuspecting and insidious for many communities. So that too, we have to make sure people know just because it's there, it's as safe as you are in the house, doesn't mean it's for you and doesn't mean you should try it. Now for the medical perspective.
Just a couple things. I think one of the things that we're grateful for is the CDC has put out some guidelines around prescribing, which I think are very critical and were very much needed. And what we're doing at CMS is taking those guidelines and working with them about getting that out to our healthcare facilities. And I think this year you're going to hear a lot more about us, a lot more from us on this issue, and really trying to enforce some of the CDC guidelines. The other thing that we're doing is monitoring provider behavior around this. One of the things that we have at CMS is we have a website where you can actually track where prescribing is going on in the Medicare program. And it's a great tool for local communities. As Kellyanne said, this is a local issue, and from the federal government perspective, we want to support their efforts, and giving them data is very important in that regard. The NIH, I think in particular, is also doing a lot of work around research and evaluation about what are the best strategies for dealing with pain. And they're helping us because we've got to figure out in terms of Medicare, what are we paying for? Are there other things that we could potentially pay for that are alternatives to the types of opioids that are available? So I think there's a lot of work going on in that particular area. We're also trying to figure out how we make sure that naloxone is more widely available, and that's one of the changes that we've done in the Medicare program, is making that a required medication that is available for individuals in the Medicare program.
We'll have time for one more question.
Hi, I'm Linda Davis. I'm from Michigan, and I am a judge there. I also run an organization called Families Against Narcotics, which just last month became a national organization. And I also have a child that is in recovery, so I've dealt with this firsthand. My question to you is that it seems in our community that there is a disproportionate amount of methadone being used for young offenders. I know that I've read everything that comes out on this, and I know that the guidelines say that methadone should be used for a small percentage, and yet in our community it's being funded for about 90% of people that are going into publicly assisted treatment. Is there monitoring that is going to be taking place to make sure that all forms of medically assisted treatment are being used and that it's being used appropriately for each individual?
We appreciate the struggles that have been going on in Michigan. You know, one of the things I think is very important, I think we talked about this earlier, is that doctors and patients need to be making decisions about what's going to work best for them. When it comes to treatment, different things are going to work well for one person, might not work well for the other, but we're doing everything we can in terms of monitoring what's effective. And I think that what providers need are evidence-based treatment guidelines, that they can understand what's available and what's going to work best.
We're gonna, don't tell Kelly Sadler, but we're gonna ask one more question.
Hi. First of all, thank you, Kellyanne, for your leadership to find solutions. It's really awesome to have you in that role. So one of the things that we're doing in North Dakota is we're asking our citizens to unite in a grassroots movement to start talking about the disease of addiction so we can eliminate the shame and stigma. As someone who's been in recovery for 15 years now, long-term recovery, I know firsthand the devastation the disease of addiction can cause. And my disease prevented me, the shame and stigma prevented me from reaching out for help and finding recovery. So I just would like to say that we concur with you on eliminating the shame and stigma around the disease of addiction is super important for this whole process. Wondering if you have any specifics that you might be planning as part of the administration around that specifically.
We are, and thank you so much, Catherine. We really appreciate you being here and always being willing to share your story and to help others similarly situated. First of all, there are already existing materials, federal ones, state-based ones, communities certainly have done a pretty good job place to place in the telltale signs. If you think you're a coworker or you're a family member or behavioral changes, and sometimes people just say they're tired or they're just having a bad day of it, or they overate, or they're having they're breaking up a relationship. We hear all these different excuses for why somebody seems like they're in a different mood or a different mindset or not fully present. And because you don't think of your coworker, your neighbor, your family member, your child as somebody, again, in the back alley with a needle coming out of their veins, that is not who is getting hooked. It is, in other words, you can do it in the privacy of your home, and that's where it's happening. People are ingesting pills on college campuses. They're buying them for $5. You have some people who won't, they read every single label about what they put in their body and has to have one ingredient or two ingredients, can't have this, can't have that, and then they buy a pill for $5 and it's laced with fentanyl and that's it. So I think it is awareness, because people don't believe it can happen to them, and they don't believe that they do any risk behaviors. There are no comorbidities for some folks. There are no other risky behaviors. Any other, quote, risk behaviors legal. Tobacco, in some states, marijuana, drinking, they're all legal. So it's not, I'm a reasonable person. I'm only doing it in moderation. But it is the pills that start out as the gateway to heroin use, as a gateway to then accidental fentanyl overdoses. So I think it's willing to have the conversation even where you think the conversation is not relevant, because chances are it is relevant somewhere where you're not putting it all together. And I think we have to start young. The First Lady has made this very clear in her remarks. We have to educate our youth. And there's a school of thought that thinks you do that through the shock the conscience type ads that we've seen in other industries. There are the warm the heart stories of treatment and recovery, and you don't need to do that to be cool or to feel awake or to feel better about something. That really getting people in touch with treating the whole patient, I think, is also the whole person, is what Administrator Byrne was saying. But I think these share the stories will also be great, because the best way to tell people that you don't need to feel shame or stigma is to give them a forum through which other people go first. And in that regard, I think it was very powerful that the president went first. It told his family's story. Everyone's got one. When I met Linda, I met her as a drug court judge, and then she came forward and told the story of her daughter who had everything going for her. And I don't mind saying that, because you just said you're a mom, you started this whole network that's now national. That allows other people to come forward and say that. But I do think it starts peer-to-peer. We found that more than anything, it has to start peer-to-peer. That's who people want to hear from. They want to hear from people who they say, I like you and you're like me. We share a common experience. But it's youth. But you also see these fatality rates, 35 to 40 to 54-year-olds too. They've increased over the years. So I don't want anybody to think we're only talking about teenagers in high school. This is everyone. A lot of seniors, the senior population, it's increasing. And so it is everyone and everywhere, and I think to that extent it should make people feel that they're not alone, but they're also not unusual in their circumstances.
No, I think you said it well. Thank you.
We have time for one.
For SEMA.
Thank you. Rebecca Clayfish, Wisconsin. We've made good progress with our prescription drug monitoring program. We have seen prescriptions go down 12% year over year, but we know that in many cases it involves more than just our Department of Health Services. Sometimes it's additionally our Department of Justice, our Department of Corrections, even our Department of Children and Families, and our Department of Workforce Development. So I suppose my question is to both the counselor and to the administrator, where we have a Medicaid waiver, and we would like to drug screen so that we can pay for treatment for our Medicaid recipients. Talk to us about wraparound care, the services that people need in order to get to treatment, to get to recovery.
That's a great question. And you know, I think you're right. It is comprehensive treatment. And it's the point that Kellyanne made earlier today, is that we don't always know what's best in Washington. Before I came to CMS, I was working with states. I had my own consulting company. And what I can tell you is that we had great ideas, and sometimes those ideas were not listened to in Washington, and we had to fight in order to have the types of reforms. And what I think is very important in the Medicaid program and in CMS as a whole is that we're listening to local communities, and we're understanding what are the issues and trying to work with them. And test out new ideas and new innovation around how we're dealing with the opioid epidemic, or even largely, dealing with poverty around the Medicaid program at large. And so I can tell you from our perspective, we're willing to try. We're willing to be a partner with states and local communities and try out innovation and ideas so that we can address those issues. That's sort of my pledge within the Medicaid program, is to really have a new era of flexibility. States are best positioned, as Kellyanne said before. They are on the front lines, and they know their populations better than we're going to know in Washington. And so, again, we just want to work with them and partner and try to come up with better ideas, and I think we can learn from each other if we're trying out new things.
Well, thank you all so much. Thank you for the women here up on the stage. Thank you for Kellyanne and Seema for all the work you're doing. And of course, thank you all for listening in to the work that the administration is working on, what President Trump is committed to in terms of dealing with this opioid crisis. I know that's something that impacts so many communities, and I can tell you that these wonderful women are working day in and day out to ensure that we find the right solution for these families. And with that, I'm going to turn it over to Kelly Sadler.